Why psoriasis begins in the gut, not the skin.
Hello everyone, welcome back to our next podcast session. We have Dr. Sandeep here, as you all know, Chief Ayurvedic Practitioner, Nirava Holistic Center at Krishna and Dr. Ayurveda Hospital. So today we'll be talking about why psoriasis begins in the gut and not in the skin. So Sandeep, I have heard that psoriasis is usually termed as just dry skin. So could you tell me what exactly is happening in the body?
So yes, that's a common misconception where psoriasis is not a surface problem. It's an immune-mediated inflammatory disorder. In modern terms, T cells become hyperactive. So these cells normally renew every 28 days, right? So if it starts doing it every 4 to 5 days, that's why we see this thick scaling. From an Ayurvedic standpoint, the three doshas in the body, like the Vata, Pitta, and Kapha, they get imbalanced. These try to contain the heat and resulting in inflammation trapped under the skin.
So could you tell me, why do some patients develop it after years of stress or digestive issues?
Because the immune system and the gut are inseparable, in more than 70% of cases, psoriasis correlates with gut dysbiosis and sluggish liver function. So Ayurveda calls this as toxins or ama utpatti. So this accumulation of metabolic toxins from the undigested food and unprocessed emotions causes this problem. When the liver is congested, the body vents that heat through the skin. So we see similar parallels in modern medicine called the metabolic syndrome or insulin resistance and even non-alcoholic fatty liver diseases. So these are frequent companions of psoriasis as well. So the condition isn't random, it's a systemic warning light.
When you start a therapy for psoriasis, what are the common triggers that you look into before starting the therapy?
Several. So mental stress, cold weather, infections, abrupt steroid withdrawals, even certain drugs like beta blockers, even lithium, also heavy alcohol and smoking. These are all conditions which can occur this trigger. Even irregular eating patterns like skipping meals or late night snacking can aggravate the Vata dosha and the Pitta in the body. So our first line of care is identifying and eliminating these triggers before we begin active therapy.
So could you tell me what exactly is the kind of treatment protocol that you follow in Ayurveda for psoriasis?
Ayurveda treats this as Kushta or Kidiba Kushta, the classical equivalent of psoriasis. So through two broad lines called as Shodhana or detoxification line and Shamana or palliative line. So the internal detox line includes Virechana Karma, that is like medicated purgation to flush out excess Pitta and the toxins from the body. So Takradhara is another type of treatment where buttermilk medicated is poured over the forehead in a continuous stream, and this helps to cool the nervous system and mind. Another type of treatment is called as Rakta Mokshana, where mild bloodletting techniques in resistant lesions are also done. Now, gentle fasting or Lankana in Ayurveda helps to lighten the metabolic load. Now, the second format is the Shamana, which I told you, where herbal formulations like Kadara Arishta and Arogya Vardhini Vadi are all medicines which helps to purify the blood and the liver. Now, the next part of the whole therapy is the external therapies. So, external therapies means bodily treatments like Abhyanga or mild massages, which helps to improve the skin quality with certain oils which help in improving the quality of the skin, and also that helps to reduce the scaling of the skin. Now, there are other conditions where you specified medicated drinks to improve the gut balance, and there are certain food or dietary restrictions that we always recommend to all patients. This includes avoiding curd, seafood, or sour and fried and too much of reheated food. So the principle is simple here. Basically reduce internal heat and stabilize digestion.
That's very insightful for me. So could you tell me, how do you integrate modern medicine with this?
I always coordinate with dermatologists to ensure safe overlap. For example, patients already on medicines, we always look into certain biomedical markers like CRP, ESR, whether it's dropping, and also if they are on vitamin D supplements, and if they are on topical applications, we make sure these are all done. And it means there's choosing balance between Ayurveda reduces the relapse frequency while modern medicine handles the acute flare-ups.
I've heard that stress is one of the major factor for the recurring psoriasis. Stress is something that we can't live without. It keeps recurring. So how do you handle that?
So in Ayurveda, we use a combination of breathing practices to reduce stress. And also we do therapies like Shirodhara, where oil is poured over the head to relax the brain. And meditation and structured routines is also very important. Scientific studies even show that the cortisol levels drop significantly after 14 days of such programs. From an Ayurvedic view, you're cooling the pitta and grounding the vata. Once that happens, flare-ups reduce dramatically.
That is very fascinating to know. Could you summarize the entire protocol for me now?
So the protocol involves 3 phases. First is reset the system. So resetting the system means detoxifying through virechana or the medicated purgation. Then giving a light diet, hydration and stress control. Second part is rebuild digestion and liver herbal support for improving metabolism and microbiome correction. And the third part is rejuvenate the skin. So when the gut cools down, the liver rests. And when the liver rests, the skin heals. That is the protocol we follow.
That is very beautifully put. Is there anything that you would want to convey to our listeners today?
Of course, psoriasis is not a life sentence. It's a message. Your immune system isn't against you. It's overheated and overworked. So cool your system, calm your mind and your skin while mirror that peace. Remember, healing is not just about skin, it's about the story beneath it.
Thank you all for listening to our wellness podcast today, and join us for more sessions like this.